Complications of cancer. Cancer is not just a single disease, and complications vary widely. Cancer can cause a wide range of complications, depending on the type, location, and stage of the disease, as well as the treatment used. These complications may arise from the cancer itself, cancer treatments, or both. 1. Physical complications. Pain, especially in advanced cancers that invade nerves, bones, or organs. Fatigue, one of the most common symptoms, often due to the cancer or its treatments. Weight loss and cachexia, unintended weight loss and muscle wasting. Nausea and vomiting, often caused by chemotherapy or tumors in the gastrointestinal tract. Breathing problems, from lung cancer, fluid around the lungs, or metastasis. Bowel and bladder issues, blockage, incontinence, or constipation. 2. Immune and blood-related complications. Infections, due to weakened immune system, especially with chemotherapy. Anemia, low red blood cell count, leading to fatigue and weakness. Bleeding and clotting disorders. Cancer can increase the risk of both. 3. Metastasis, spread of cancer to other organs, leading to additional organ dysfunction, e.g., brain, liver, lungs, bones. 4. Neurological and cognitive issues. Brain metastases or primary brain tumors can cause seizures, confusion, memory loss. Chemobrain, cognitive impairment related to chemotherapy. 5. Psychological and emotional complications are depression and anxiety, common among cancer patients and survivors. Emotional distress, due to uncertainty, pain, or life changes. 6. Treatment-related complications. Hair loss, skin changes, infertility, and early menopause. Organ damage, e.g., heart, kidneys, from chemotherapy or radiation. Secondary cancers caused by radiation or some chemotherapy drugs. So now, how can cancer be prevented? Cancer prevention involves reducing the risk of developing cancer by making healthy lifestyle choices, getting regular screenings, and avoiding known risk factors. While not all cancers are preventable, a significant percentage can be avoided. 1. Lifestyle changes. Avoid tobacco. Smoking and tobacco use are linked to many cancers, including lung, throat, mouth, bladder, and more. Limit alcohol. Excessive alcohol increases the risk of liver, breast, esophageal, and other cancers. Eat a healthy diet. Focus on fruits, vegetables, whole grains, and lean proteins. Limit red meat and processed meats. Exercise regularly. Aim for at least 150 minutes of moderate exercise per week. Maintain a healthy weight. Obesity is linked to many cancers, including breast, colon, and pancreatic cancer. 2. Protection from the sun. Avoid excessive sun exposure, especially between 10 a.m. and 4 p.m. Use broad-spectrum sunscreen, SPF 30+. Wear protective clothing and avoid tanning beds to reduce skin cancer risk. 3. Vaccinations. HPV vaccine prevents most cervical, anal, throat, and some other cancers. Hepatitis B vaccine reduces risk of liver cancer. 4. Regular screenings and checkups. Screenings like mammograms, pap smears, colonoscopy, and low-dose CT scans help detect cancers early or prevent them by finding precancerous changes. Early detection significantly improves treatment outcomes. 5. Avoid environmental and occupational hazards. Limit exposure to known carcinogens, e.g., asbestos, benzene, certain pesticides. Follow safety protocols at work if exposed to chemicals. 6. Know your family history. Genetic counseling and testing may help if you have a family history of cancers, e.g., BRCA1 or 2 for breast and ovarian cancer. Preventive measures may include more frequent screenings or preventive surgery. If you already have cancer or are seeing signs and symptoms, what can you do? You should visit your healthcare provider. Let's take a look at cancer treatment. Cancer treatment depends on the type of cancer, its stage, the patient's overall health, and personal preferences. Often, treatment involves a combination of therapies. Here's an overview of the main options. 1. Surgery. Purpose: to remove the tumor or as much of it as possible. Best for localized cancers, e.g., early-stage breast, colon, or skin cancers. 2. Radiation therapy. Purpose: uses high-energy rays to kill cancer cells. Types: external beam radiation or internal radiation. Brachytherapy. Often combined with surgery or chemotherapy. 3. Chemotherapy. Purpose: uses drugs to kill fast-growing cancer cells. Systemic treatment affects the whole body. Used for many cancers, especially those that have spread, metastasized. 4. Targeted therapy. Purpose: attack specific molecules or genes that help cancer grow. Fewer side effects than chemotherapy. Example: HER2-targeted drugs for some breast cancers. 5. Immunotherapy. Purpose: helps the immune system recognize and attack cancer cells. Types include checkpoint inhibitors, CAR T-cell therapy, monoclonal antibodies. Effective in melanoma, lung cancer, certain blood cancers, and more. 6. Hormone therapy. Purpose: blocks hormones that fuel certain cancers, e.g., estrogen in breast cancer, testosterone in prostate cancer. Used for breast, prostate, and ovarian cancers. 7. Stem cell, bone marrow, transplant. Purpose: replaces damaged or destroyed bone marrow with healthy cells. Common in leukemia, lymphoma, multiple myeloma. 8. Precision medicine. Customized treatment based on the genetic makeup of the cancer. May involve gene testing and matching to specific targeted drugs or clinical trials. Supportive, palliative care. OSU focuses on relieving symptoms and improving quality of life. Important at any stage, especially for advanced cancer. If you have any questions or doubts or add-ons, feel free to comment. Thanks for watching. Please comment, like, share, follow, and subscribe for more educational contents. See you in the next time.